Hi, I am Dr. Krishna Patil. I am a consultant nephrologist at KIMS Hospitals, Gachibowli, and as part of our kidney health education series, today we will be discussing the diet for kidney disease patients. So, chronic kidney disease patients, we emphasize a lot on their diet because when the kidneys, which are the cleansing organs of the body, when they are unable to do enough cleaning of the body or the blood, then the diet should be such that it won't produce more toxins. So, which are the common toxins that we hear of often? The urea and creatinine. How are they produced? They are the nitrogenous wastes. So, the foods which have excess nitrogen in them are those foods which are more proteinaceous. So, more or high protein diet will produce more nitrogenous wastes. If the kidney is failing, it will put an extra burden on these failing kidneys for cleansing these nitrogenous wastes, and the kidney failure will progress faster. So, the principle here is to reduce animal protein intake in the regular diet. Vegetarian protein may be allowed because protein is an important component of our nutrition or diet, and our body needs proteins for multiple functions and muscle strength. Immunity. If we reduce protein intake too much, then the patient may become weak, prone to infections, and infections can cause quick rise in creatinine. So, all our efforts to prevent progression of kidney disease can be jeopardized because of malnutrition. So, we want our kidney disease patients to have optimum protein, not too much, not too low. So, how much is optimum? It is 0.8 gram per kilogram of their ideal body weight. For certain patients with advanced kidney disease, we may also recommend them on a low protein or a very low protein diet in an attempt to postpone dialysis by another 1 or 2 years. But to prevent malnutrition in such patients, we may have to supplement them with keto analogues to prevent protein malnutrition. The second component of our CKD diet is the potassium. CKD or kidney disease patients are likely to have higher potassium in their blood because the kidneys are not excreting potassium enough. The foods that are rich in potassium have to be avoided. Which are the foods that are rich in potassium? The fruits, green leafy vegetable, the dry fruits, nuts, seeds, these are rich in potassium. We have to emphasize coconut water here and bananas, which are very high in potassium. They should be strictly avoided in CKD advanced stages. Fruits that are safe or low in potassium are apple, pineapple, guava, papaya, pear. These fruits can be eaten in moderation. Even despite of dietary potassium restriction, if the potassium levels are high, the doctor may do necessary changes in the medication to reduce the potassium levels in the blood. If despite of that the potassium is on the higher side, we may also recommend to do leaching procedure on vegetables before cooking. What is leaching? Leaching means cut the vegetables and put them in warm water for 5 minutes and then discard the water and use those vegetables for cooking. That way you will reduce the potassium in the vegetables. Third thing is about salt. This is very important. The kidneys are unable to excrete enough salt and water. So, CKD patients start accumulating salt and water, causing swelling in their feet, swelling in their lungs, causing breathlessness and rise in blood pressure. So, strict salt restriction and water restriction is important for those who are getting higher blood pressures and swelling in their feet. Salt should be less than 5 grams per day and water should be restricted to 1.5 liters per day for those who are getting swelling. These are some important tips in diet for CKD patients. I hope this was helpful. Thank you.